Good afternoon, everyone, and thanks for being here today. A special thanks to Dr. Mysheika Roberts, Columbus Health Commissioner, Dr. Andy Thomas from the OSU Wexner Medical Center, Dr. Amy M. from OhioHealth, Dr. Nick Kreatsoulas from Mount Carmel Health System, Dr. Rustin Morse from Nationwide Children's Hospital. As you all know, Governor DeWine just announced that Franklin County has just moved back to purple status. In a few moments, Columbus Public Health Commissioner Dr. Mysheika Roberts and our health systems are going to give you more details about what this means for our community. I want to take a moment to lay out what we can do right now to spare our healthcare workers from being overwhelmed, to protect the lives of our friends and families, and to keep our economy open. We need to go back to what we practiced when the virus first entered our community. We must use all the tools we have to prevent the spread of COVID-19 and get to the other side of this pandemic and back to a sense of normalcy. To protect ourselves, our families, and our community, continue to wear a mask, wash your hands, stay at least 6 feet from others, stay home if you're sick, avoid large gatherings. The major difference between where we were a year ago and where we are today is that we have the opportunity and the power as individuals and collectively as a community to get vaccinated. There is light at the end of the tunnel, and I need each and every one of you to be that light and get vaccinated. We can do this. We've done it before, but it will take commitment from everyone to help our community stay safe and healthy. Now, it is my pleasure to introduce our Health Commissioner, Dr. Mysheika Roberts.
Thank you, Mayor Ginther, and good afternoon, everyone, and welcome. As you heard Mayor Ginther say today, that the state announced that Franklin County has gone to level 4 or purple on the public health advisory system. While today we are not close to the numbers that we saw at our peak in November and December, moving to level purple is a stark reminder to everyone that COVID-19 is still here and actively circulating in our community, and we must use all the tools available to us to reduce the spread. Franklin County met 6 out of the 7 of the state's public health advisory system's indicators. Those 6 indicators include new cases per capita, sustained increase in new cases, sustained increase in non-congregate care settings, sustained increase in emergency department visits, sustained increase in outpatient visits, and sustained increase in hospitalization rates. While this is concerning, it is important to note that the state system follows day-to-day changes by percentages of change, not by volume of change. That's an important note to make, and I want to make it very clear to everyone that this purple declaration does not mean that schools should close or go remote. We know so much more today, as the mayor described, than we knew 5 months ago, which was the last time we went purple. So again, this purple declaration does not mean schools should close or go remote. In Columbus, we are seeing over 200 cases per day, and that's compared to our previous low of about 150 cases a day in March. We suspect that a lot of what we're seeing today is picking up the activity that occurred during spring break and the recent travel of many of our residents. In Columbus jurisdiction, just over the last 3 weeks, we've seen an increase in reported cases among all age groups, but the majority of our cases, the largest increase, is in between the ages of 20 and 49 years of age. Since March 14th, So a month ago, 70% of our weekly case increases were among this age group. 70% of our weekly cases were among this age group, yet they only represent 48% of our population, and that age group again is 20 to 49. We've also seen a decrease in the average age of our cases. If we looked at our cases back in November, the average age was about 40. If we look at December, it was 37. In November and December, the average age was 40. If we looked just 3 weeks ago, the average age was 37 of our case. And now if we look at our cases, the average age is 35. So the age of our cases are dropping. So now I'd like you to hear from some of our hospital partners about what they're seeing in the hospital. And so first I'm going to turn it over to Dr. Thomas from OSU.
Thank you, Dr. Roberts, and thank you all for being here today. First, I'd like to make a couple of comments about what we're seeing across the region. Many of you are familiar with the term Zone 2. Those are hospitals across over 30 counties in Central Ohio, Southern Ohio, and Southeastern Ohio. We are seeing an increase in hospitalized patients with COVID in the counties that make up Zone 2. We had gotten down to a low in the 170s, and now we're up close to in the mid 280s. So it's nowhere near where we were back in November, December when we were in the 1200 range. However, it is a 68% increase from just the middle of March. So the same trends that we're seeing for increases in cases across the state, across Central Ohio, are making for increases in cases in the hospital as well. In Franklin County, in the adult hospitals, we actually yesterday reached 182 patients in the hospital. Now that's not nearly as high as where we were back in mid-December when we peaked at over 600 patients in the adult hospitals in Franklin County with COVID. However, it's an over 100% increase from what we had just in the middle of March. So what we're seeing at Ohio State is similar to that. We're now in the 50s in terms of our number of patients with COVID in the hospital. In the middle of March, we were down under 20. Once again, that pales in comparison to over 200 acute active COVID patients in the hospital back in that November, December timeframe. However, the trends are what they are. What we're seeing, as Dr. Roberts was describing the metrics that make up the state's color-coded system, remember, as we talked a lot back last summer, it's an early warning system. It's like the weather report. It's telling you what's coming in the future. A lot of those early indicators are what are flagging. So there is time to change our behavior, to re-emphasize what you've heard about with masking, distancing, avoiding large crowds where you can't control your environment, where there isn't distancing that's enforced through seating or other types of regulations. It's important that we focus on getting people vaccinated. What we're seeing at the Wexner Medical Center is a significant decrease in those that are over age 80 that are being admitted to the hospital with COVID. If you look back at the last 6 months, we have averaged between 7 and 16% of our COVID admissions have been people over age 80. In the month of March, it was 3.5%. So half of what our best month was in the previous 6 months. In March, that is fruit that's being borne by vaccinations that were done in January. Remember, folks over age 80 were the first group that we started to vaccinate. Those folks who were vaccinated in January are not being admitted to the hospital with COVID in March. And we envision moving forward with April, May, and June, we'll see that same stagger as younger patients were able to be vaccinated moving through February and March. We'll see those same trends hopefully continue. So with that, I'm going to turn things over. I believe, who's next? Dr. M. Turn things over to Dr. M from OhioHealth.
Thank you, Dr. Thomas. I'd like to reiterate what Dr. Thomas just said about the demographics of patients in our hospitals. We've seen a pretty significant decrease in the average age of those now being hospitalized with COVID. It's gone from a mean of about in the high 60s, 68 years of age on average down to about 62. What that translates into in real life is that we're not seeing the 80 and 90-year-olds landing in our ICUs with life-threatening illnesses. because they're unvaccinated. If they are unvaccinated, we are still seeing an occasional patient, but the vaccine is showing to be extremely highly effective in doing what it purported to do, which is not eliminating infection, but reducing that risk of severe illness, hospitalization, and death. So we want to continue to encourage everyone to get the vaccine. How do we know that it works besides the fact that we're seeing improvements in our hospital patients? Well, I always look at our own associates and our providers. Before vaccinations were available, we had 600 people at a time during the peak who were out on quarantine, either with active COVID or having been exposed to COVID, generally out in the community, not in our hospitals. We're down to under 50 patients a day now, or associates a day now, who are on quarantine. And again, they're not getting it in the hospitals because they're doing two things. They're getting vaccinated and they're wearing their masks. So when they do contract the infection, it's because they're out and about in the community, usually having lunch with a friend, taking off their masks and sitting and talking for an hour. So again, these are the things that we're seeing now. Our healthcare heroes are out there every day, though, still taking care of the patients who are being admitted with COVID. They're working extra shifts to give patients vaccines, the first and the second doses of the vaccines, and they're loving doing it because they feel like they're giving so much to their communities. So we ask that the communities continue to be vigilant in the wearing of masks and also encourage each other to get the vaccination. And now I'll turn it over to Dr. Nick Kreatsoulas from Mount Carmel.
Thank you, Dr. Ibben. Thank you, everyone. Over the recent weeks, Mount Carmel has seen an increase in positive COVID cases at our hospitals. Despite the spike in the cases, we're well positioned to take care of patients in our community, as well as my other hospital partners. We're actively monitoring patient data as it comes through the hospital, as well as patient demographics. What we're seeing is an increase in the younger population, as Dr. Thomas and Dr. M have mentioned, the 30, 40, and 50-year-olds that are now presenting and being admitted for COVID. This reflects many individuals who have not been able to be vaccinated, and I want to stress that have not been able to be vaccinated. We're also seeing a slight uptick in our ICU admissions, as well as an increase in our ED visits related to COVID-19. While our cases have risen, we are not where we were during the surges during the winter months. However, now is not the time to let your guard down. The rise in cases won't end unless everyone does their part to end it. We urge you to stay vigilant and follow the guidelines put in place by our national, regional, and local health officials. We need everyone to wear their masks in public, maintain safe distances, wash their hands, and continue to avoid large events as much as possible. We know the COVID-19 vaccine, designed to prevent severe disease, is the best hope for ending the pandemic. And we encourage those who are eligible to get vaccinated. Safety is one of the top priorities of our institutions at Mount Carmel, and we also are in position to continue to vaccinate over 7,000 individuals a week. We know that there are still many questions and concerns about the vaccine. That's why Mount Carmel is committed to keep our community informed and educate as major developments occur in the vaccine. And that's through our mountcarmelhealth.com and our social media links. And throughout the pandemic, I just wanted to say thank you to my partners behind us and Columbus Public Health. We work very closely together to continue to strive to help our community and make sure that we try to control the pandemic as much as possible. Thank you very much, and I'll turn it over to Dr. Morse from Children's Hospital.
Good afternoon. Thank you for being here today. So my colleagues have shared with you that the age of the patients being hospitalized with COVID is going down, so fewer older adults are being hospitalized with COVID. I'm here to share good news. It's not going down all the way to the pediatric age group. So we are not seeing more children being hospitalized with COVID. This continues to be, from a hospital perspective, generally an adult disease. Our volumes have been low, have been stable, and children generally do quite well if they get COVID. However, it's been dramatic to children from a psychological and behavioral health perspective, and that's where it's almost been, frankly, devastating from a pediatric perspective. Children being out of school, out of sports, not having social contact for almost a year is devastating. So as the mayor and Dr. Mysheika Roberts said, we need to keep the schools open. It's imperative, it's safe, it's the right thing to do. So we need to make sure, despite turning purple, that we keep the schools open. To do that, we need to have people wearing masks, and we need to have people getting vaccinated. Teachers were prioritized for vaccines, and now students can get vaccinated if they're over the age of 16. With Dr. Roberts' help, we're in the school districts now vaccinating at the schools, and the uptake has been quite good, but it could be better. There's almost no reason for a healthy 16-year-old child not to get vaccinated to help protect him, herself, their family, and the community. Soon we'll be able to vaccinate children as low as the age of 12, and we're looking forward to that, and we'll need to aggressively do that. So my message to you and to the community is to make sure you wear your mask, make sure students wear masks, allow students to participate in sports, ideally and preferably outside, but wear masks when they're on the bus, wear masks when they're together in groups, and get vaccinated. Thank you.
Well, thank you to my hospital colleagues for sharing their perspective on where we are at this point in the pandemic. We do work well together, and I couldn't do this without their support. So I think you've heard it loud and clear of what we need to do, and I feel pretty confident that we as a community can do it. We all need to work together to make this happen. We need to wear our masks, we need to stay 6 feet apart, we need to avoid large gatherings, and most importantly, if you have not been vaccinated, please get vaccinated. Anyone who is 16 years of age and older in the state of Ohio is eligible for the vaccine. We're here today at the Celeste Center where we offer vaccine here in the community by Columbus Public Health. So I encourage people to get vaccinated. Thus far, Columbus Public Health has given over 117,000 doses of the vaccines. Shots are readily available. All of my partners behind me, we all have vaccine clinics, and you can get a vaccine by going to our website or calling our locations today and get registered for an appointment. We are offering Pfizer and Moderna, and again, Pfizer is available for anyone who is 16 years of age and older. They are the quickest way and the best way for us to get back to a sense of normalcy as quickly as possible. We need to increase those vaccination rates, though. Here in Franklin County, only 22% of the population has received 2 doses or has been fully vaccinated. 35% of the county has received at least 1 vaccine. We need to do better. We must do better. Getting vaccinated and back to a sense of normalcy is what we all want and we all need. As you heard from Dr. Morse, we need to start focusing on some of the other issues that this pandemic has exposed, like mental health issues, like drug addiction, like housing instability, unemployment, and just a sense of normalcy that we all crave for. So we can do it. I'm confident we can all work together and get this done. Please encourage others to get vaccinated. And now I'm going to turn this over to Mayor Ginther. Thank you.
Well, thank you to all the health systems and the incredible physicians here today. There's a reason we wanted to do this here at the Celeste Center, because we think this best represents the way that we have dealt with this global pandemic all together. The health systems and public health working together to make sure that we were doing everything in our power to protect the health of this community. I got my second shot here on Friday, and there is a sense of empowerment that you get when you get vaccinated. And so at times during this pandemic, when we have felt overwhelmed, alone, and fearful, We now have the power to make sure that we come out of this pandemic stronger than before. But it requires us to stay the course with distancing, with masking up, avoiding large gatherings. But we have something today that we did not have a year ago, a vaccine. And we need to step up and do our part for everyone that is eligible. Call Columbus Public Health today. Go to Columbus Public Health's website and schedule your vaccination. And if you've gotten your first dose, show up and do your part for your community, for your neighbors, so that we all can get back to what we miss most and love most about this community. Be happy to take any questions.
On the state's website, the definition of purple level is really only go out for necessities, for services. Is that something that you are recommending right now, or just continue those mitigations like masks, social distancing?
Yeah, so I think just to make it clear, you're stating on the ODH's website when they define what a level 4 or purple is, that you should really limit your activities. That obviously is the recommendation if you have not been vaccinated. I clearly support that if you have not been vaccinated. For our community that has been vaccinated, you can definitely go about your daily activities. Kids should continue to go to school. They should continue to participate in sporting and extracurricular activities. We just want them to be super vigilant about wearing their masks, washing their hands, and keeping that social distance. And so, yes, if you are an adult who's eligible to get vaccinated and for whatever reason you're choosing not to get vaccinated, you should be mindful that the disease is out there, the virus is out there, and you want to protect yourself as well as others around you. But public health is not recommending a stay-at-home advisory or any closure of any of our businesses or anything of that nature.
What do you think is driving the increase? Can you hear me okay? Mm-hmm. Is driving the increase in cases in the younger population? Is it that they haven't, not all of them have been vaccinated? Are they relaxing when it comes to some of the social distancing? What do you think is the main reason behind more cases in the younger population?
There are a few reasons. You clearly heard from us that the age of our average case, as well as the age of those who are hospitalized, is decreasing. So the younger population, which we know is the population that was last able to get vaccinated. They just became eligible in the last 2 weeks or so. So that is a factor. They're not vaccinated. I think people have COVID fatigue, so they're not practicing the masking, the social distancing like we want them to. And then I think another factor that we all have to consider is the variants. We have variants now that are definitely more contagious than the virus that was circulating in the last summer and the fall and in the winter. And so that makes you more likely to be symptomatic and once you're exposed and get sick. So I think it's all three of those combined that are playing into why we're seeing an increase in our younger population.
I know you mentioned spring break might be a cause for these increasing cases. Does that mean we'll see a decrease in these next couple of months?
We believe that will be the case. We believe that because there were so many spring break activities where people were traveling outside of Ohio and going to places like other states that had better weather, where we know there is high virus activity, that could have contributed to what we're seeing now. We're hoping, we're optimistic that now that travel is over and now that more people are eligible to get vaccinated, we will start to see a decrease in cases over the coming weeks.
The mayor mentioned that to avoid mass gatherings. In 2 days, there's going to be roughly 20,000 people at Ohio State for the spring game. How do you reconcile that?
So, yeah, the mayor said avoid large gatherings, and I think if he didn't or someone else said, in environments where you can't control what's going on around you and you feel it's not an organized approach, I'm very confident at the approach of what Ohio State is doing and really all of our sports venues that are having fans. They're having a much smaller number or lower number of fans than they're accustomed to, and they have very good plans in place to make sure everyone enters safely, is seated safely, and leaves the facility in a safe manner.
What's different when it comes to here in Central Ohio that we have triggered into purple, whereas the other big cities in the state, Cincinnati, Cleveland, they haven't gotten to that level yet?
I don't know if I can answer that. I'm going to look back to any of you. The question is, what's different for us? You know, I do believe that we probably do more testing here in Franklin County, but I don't know. Do you have any idea what might be different?
So I haven't seen all of the state data since it was just released literally right before. So it's hard to know without looking at all the other counties. But remember, this is a combination of 7 different metrics. So some of those are those early warning metrics. So people going to either an emergency department or to their physician or provider with influenza-like or flu-like illnesses that could be COVID. That doesn't mean they've been diagnosed with COVID. It means that was their presenting symptom. So I think in reality, what this is that early warning system. So we're seeing those early signs of that fact that the case numbers could go up. I think Dr. Roberts is correct if this is related to spring break and people follow the recommendations now that they're back home and have not gotten others sick. Hopefully we'll see those numbers track back down. But without looking at all the other counties, it's a little bit difficult to know exactly why another county didn't flag, but it's not just the number of cases. We actually aren't the highest county in terms of the case numbers per 100,000 over the last 2 weeks. We are in that group that's over 200, but we're not the highest county by any means. So it's that combination of all 7 metrics. And actually, one thing while I'm at the podium, I just want to make clear, in terms of the vaccine, we are still on a daily basis doing Pfizer vaccine at the Schottenstein Center and 3 days a week at OSU East Hospital. We have appointments available same day, next day. I look forward through next Tuesday, and we have hundreds of open first dose vaccine appointments. Obviously, our website has access to schedule, but also our number is 614-688-VAX, V-A-X-X, 614-688-8299. And we really strongly encourage individuals to be vaccinated. We've done over 160,000 doses of vaccine and over 100,000 individual people. In fact, just today we crossed the number of our total first doses is greater than the seating capacity of Ohio Stadium. That just gives you an idea of the volume of people in this community that have stepped up, rolled up their sleeve, and gotten vaccinated just at my hospital. Not so much even counting all of our hospitals and this facility. So a lot of people in Central Ohio, in Columbus, are doing the right thing. We need more people too. We need to get that number up higher. As we get more younger people vaccinated, that's going to help with the spread as well. So now that it's only been 2 weeks that those between 16 and 40 are eligible to be vaccinated, we're quite proud at the university that over 1/3 of our students have either scheduled or gotten their first dose of vaccine. We want them to be the role models for other young people in this community to step up and do the right thing and get vaccinated. Thanks.
So I think just to wrap up, thanks to all the health systems and everyone for their continued partnership. I think what's important to remember is that this status, as Dr. Thomas and I think Dr. Roberts references for, is an alert. It's not a time to panic. It's not a time to overreact. We know what we need to do, and now we have the power of the vaccine. So we have to remain committed to the public health of the entire community, do the things we know we need to do, double down on those strategies, and get vaccinated. That's the fastest way to getting back to the people and the things that we love in our community. Thanks for being here. I'll ask folks to stick around for a few minutes if you have any additional questions. The one other point I forgot to make to reinforce what Dr. Roberts shared, any large-scale events, the graduation, sporting events, those types of things, they are working, those organizers are working with Dr. Roberts and the public health team, putting plans in place for those events. Those things aren't just happening. And so Dr. Roberts and her team will continue to work with those types of events to make sure that folks are spaced out, that they're coming in and leaving safely, and that they're masked up appropriately when they're in those environments. So thanks to Dr. Roberts and her team. Thanks, everybody.